All right, so I'm going to be palpating the IT band, which is also known as the iliotibial tract. So to first do that, you're going to find the tendon of the biceps femoris, which will be located right here. And then you're going to run your fingers anteriorly to the lateral side, and then you'll be able to rub your fingers horizontally, and you'll be going across the fibers of the IT band.
So now we're going to be looking for the muscle belly of the semimembranosus. To find this, you can have your patient lift up their leg and try to get them to pull against the force. You should be able to find the tendon of the semitendinosus by doing this. And if you work your way up from there into the medial side of that, you should be at the muscle belly of the semimembranosus from there, because it lies underneath and medially to the semitendinosus. So it should be right here. Now we're going to be looking for the lateral condyle of the tibia. And to do this, you can start at the patella. And if you start there and work your way down, you're going to find your tibial tuberosity. And if you move lateral to that and a little superior, the next bump that you should feel is your lateral condyle, so it should be right here. If you move straight, you would end up at the head of the fibula, so you want to make sure that you move up with it as well.
So next I'm going to palpate the gluteus medius, and for this you want your patient in a sideline position. First you're going to find the iliac spine right here. You can tell by the laughing she does. Next, you're gonna find the IT band, which would be located right here. And then you're gonna wanna do, it's kind of like a triangle. You're gonna bring your fingers together into a triangle, and then that is where your gluteus medius would be. So IT band, iliac spine or crest, and then triangle. So your gluteus medius would be right here. I'm gonna be assessing range of motion for knee extension. In order to do this, you'll have your patient laying in a supine position. For this instance, we're going to be using a backpack, but you can use a pillow or a foam roller to have their ankles elevated a little bit. Using the goniometer, you're going to place the fulcrum at the lateral femoral condyle. You'll have the stationary arm pointed towards the greater trochanter, and then you'll have your movement arm pointed towards the lateral malleolus, so it'll look like this. And the reason for this is because you're testing to see if there's hyperextension in the knee. So she is at 0, and the optimal range of motion, or the average range of motion, is 0 degrees for knee extension. So she is in the range of normal range of motion for knee extension.
I will now be checking the range of motion for hip extension. To do this, I'll be having my patient laying in a prone position, such as this, and I'll be using a goniometer to check this. So the fulcrum will be placed on the greater trochanter, so right here. Your stationary arm is going to be facing and in line with the trunk, and the movement arm is going to be in line with the femoral condyle on the lateral side. And his starting number is 85. I'm going to have him lift his leg up. So lift your leg up and keep your pelvis on the table. Okay. And his ending number is going to be 87, going the opposite direction. The normal range of motion is 30 degrees, and his range of motion today was 23 degrees, which isn't quite average. I will now be checking the range of motion for hip abduction, abduction. And to do this, I'm going to be using the goniometer again. And I'm going to be placing the fulcrum of the goniometer on the ASIS. So it's going to be right here. And the stationary arm of the goniometer should be facing the opposite ASIS, and the movement arm should be facing the center of the patella. And right now he is at 90 degrees. And I'm going to get him to move his leg out towards me, but we're going to try to keep his knee from rotating because then that wouldn't be abduction anymore. So go ahead and move your leg out. Okay. So his ending motion was at 118, so he had 28 degrees, and normal range of motion for abduction is right around 35.
I'm going to be assessing range of motion for external rotation. Using the goniometer, I'm going to place the fulcrum on the patella. I'll have the stationary arm perpendicular with the floor, and the movement arm is going to be in line with the midline of the tibia. So I will have the patient bring her foot, rotate her foot in, or bring her foot in as much as she can to see external rotation. So go ahead and bring your foot in. So you gotta keep it on the patella. Stationary arm stays down perpendicular, and then the movement arm is gonna go in line with the tibia, so you can relax. And she is at 47 degrees of motion now. So the normal range of motion for hip external rotation is about 50 degrees. So
I will now be doing a muscle movement test for the rectus femoris, and the action of the rectus femoris is knee extension. So to test this, I'm going to have my patient raise his leg up. I'm going to instruct him not to let me push his leg down. So, all right, you can relax. And because my patient was able to do the full range of motion and hold it against maximal force, he would be at a level 5, which is as high as you can be for a muscle movement test.
So now I'm going to be doing a muscle movement test for the adductors. In order to do this, you'll have your patient in a side lying position. I'm going to be standing behind the patient. I'll have the leg that I will not be testing, that's going to be doing the abduction, to have her raise that leg, and I'm gonna hold it with my right hand on her femur right here, and then I'll have her pick up the testing leg up and then tell her to resist as I push down. Yep. And she was able to have range of motion to get it up, and she was able to resist against maximal strength, so she'll have a 5 for her adductors, her adductors.
Okay. So I would now be showing you how to strengthen and stretch your semitendinosus muscle. One way you can strengthen the semitendinosus without a weight would be to lie on the ground with your knees bent, and you're just going to come straight up into like a bridge, and you should feel it in the hamstring group of your semitendinosus. And then another way to strengthen it with a weight would be an RDL, and so the weight we're going to be using today is this leg. And to do an RDL, you would just come straight down and then come straight back up while trying to keep your knees straight. And then one way to stretch your semitendinosus would be to sit on the ground and have one leg bent, and you're just going to hold your foot on your other leg that you keep straight, and you would hold this for about 60 seconds to give your muscle time to react and realize that it's trying to be stretched.
I'm going to be showing you 2 ways to strengthen the sartorius. And one of those ways with a weight can be squats or side lunges. So you have the barbell over your neck and then you just do a squat, or you can do a side lunge and then come back up. Another way that you can do without weight is step ups, so lateral step ups. I'll just use this for now. So lateral step up, you'll step up and then go back down. And then that will be a way to strengthen your sartorius without weight. And then one way to stretch the sartorius is a movement called 90-90. So you're gonna be sitting on the ground. You'll have one elbow back. You're gonna have one leg, one hip at a 90-degree angle, and then on your other leg, you'll have your knee at a 90-degree angle. And what you're gonna do is take your pelvis and rotate it towards the floor, and then you'll be able to feel the stretch in the sartorius on the leg that you have the 90-degree flexion in you. So you'll be able to feel the stretch right here going across your leg all the way down the sartorius muscle.